Today I'm going to talk about my capstone project with Eskenazi Mental Health Recovery Center on advocacy and education for occupational therapy's role in inpatient mental health services. My name is Abigail, and I hope you enjoy this presentation. My capstone site was Eskenazi Mental Health Recovery Center, which is a 30-bed inpatient mental health facility. Patients here are receiving acute services from staff members, including social workers, care coordinators, nurses, psychiatrists, support specialists. There's pharmacists that's on staff, as well as administrators and one occupational therapist. In order to be a patient here, really your qualifying factors are if you're a danger to yourself or to others. Many of the diagnoses that I saw included bipolar, schizophrenia, psychosis, major depressive disorder, anxiety, various personality disorders such as paranoid or borderline, and many of our patients had either a co-occurring diagnosis of autism or a developmental disability. My project was working to update OT services to fit best practice and complete education for the various staff members on this. Through completing a needs assessment, I found that there was multiple needs at this site for a capstone project. For instance, my site mentor made it clear that there was a lack of understanding from leadership. After she talked with me, she then went to her leadership and advocated for OT's role on the unit. She brought literature to them, and after their meeting, they decided to allocate one full-time position to the mental health unit, which was really great. But what that meant was there was a need for education of the unit staff on what OT's role was, different kind of topics that we could help serve them to help increase our interprofessional work, as well as education from the general occupational therapists to know what was going on over on the mental health floor and unit to increase kind of these feelings of community between the mental health therapists and the general OTs. There was always a need for more advocacy for OT's role in mental health, and it was clear that there needed to be some resources created for the occupational therapist who was going to be working in mental health. After completing this needs assessment, me and my site mentor came up with my kind of goals and objectives for my project. My project aim was to create education and resources for occupational therapists and mental health professionals working in inpatient mental health through in-person education, advocacy, and online resources for both therapy and non-therapy staff. My overall goal was to increase understanding of occupational therapy's role in inpatient mental health by creating a resource guide and completing staff education. In order to ensure that my project was evidence-based, I completed a literature review. Through that literature review, I found that OT has a lot of value in mental health, including addressing life skills needed to support lifelong recovery for these patients, reducing readmissions through assessing level of function, and participation in meaningful activities can be a predictor of quality of life. There's also unique evidence-based interventions that occupational therapy can offer clients to facilitate their recovery. Some of the most common interventions that I found in literature include employment and education, psychoeducation, creative occupations and activities, occupational balance, life skills, and habit development, group and family approaches, as well as animal-assisted therapy. Researchers have also found that there is a moderate evidence for life skills training, ADLs training, and neurocognitive training paired with skills training. They also found that social skills training has a moderate to strong levels of evidence. I use this to plan my interventions and also um, looking at the model of recovery, which I'll touch on in a little bit. One of the models that I used to guide my capstone was the recovery model. I used this a lot in my intervention planning and patient care throughout my project. Now, some people may see recovery and think specifically substance abuse, but the mental health unit also uses this term recovery. The Substance Abuse and Mental Health Services Administration defines recovery as a process of change through which individuals improve their health and wellness, live a self-directed lifestyle, and strive to reach their full potential. This aligns with the values that occupational therapy sets. And as you can see through this diagram, there's these 10 guiding principles that also mirror the beliefs of occupational therapy. These principles include person-driven, many pathways to recovery, a holistic approach, ensuring peer support, using relational models, highlighting the person's culture, addressing their trauma, focusing on strengths and responsibility, having respect for everyone in the process, and hope. I believe that this closely aligns with occupational therapy, and I use this throughout my patient care as well as with my education, focusing on trauma-informed care and the importance of routines and engaging the patients in meaningful activities, which helps to ensure they have a meaningful recovery. Another theory I used to help guide my project was the ecology of human performance model. This focuses on many ways to improve occupational performance. One reason why I chose this model is it has use in working with individuals and at an organizational level. For the instance of my project, the person or persons were the mental health unit staff and the occupational therapists. I use many of the different interventions that this model suggests to help improve their performance, in this case, their understanding of OT and mental health. For example, I used establishing guidelines and setting expectations for the units. This can be considered establishing and restoring. I also provided education to the staff members that are currently working on it. Again, this would fall underneath this establish and restore kind of intervention that this theory lights out. I also set up like e-learning modules for onboarding a new therapist, which would prevent hopefully a new employee from feeling lost or not addressing important areas in the patient's care. I hope through this you can see how I use this model throughout my project and how it was really beneficial to keep in mind when working with both staff members and patients. So looking more at what my project ended up being was a resource guide for an occupational therapist working in inpatient mental health. This resource guide included a spreadsheet with evidence-based assessments and outcome measures, a Word document with group and individual interventions, including group protocols that I had completed while working on the unit, a list of example goals that they could use, common vocabulary used on the unit, common pharmaceuticals, and unit staff roles. I organized this in an online shared drive so that my site may update the resources as needed. Another part of my project was education for mental health unit staff. I did this through choosing a couple topics just to kind of really make it relevant to them. So I chose the importance of routines and trauma-informed care. I held two educational sessions, and as you'll see in a little bit over my results, I had an increased understanding of both trauma-informed care and the importance of routines. Another part of my project was the education of general occupational therapists. So I did this by sharing what I had been completing through my project and the expansion of OT services over on the mental health unit, and then sharing with them how to address mental health in any setting. So I focused on different rehabilitation measures that they could use, looking at sample goals so that they're able to document their services, and things to look out for to let them know that maybe they should be addressing mental health in any of the practice settings that they may work with. And finally, kind of throughout this project, I was helping with the initiation of occupational therapy services. So I completed some initial evaluations, worked with patients for one-to-ones, and also led group services. As you can see, there was either an increase in understanding or a consistency with the level of understanding for the mental health unit staff education. There was an increase in their understanding of how to apply trauma-informed care, how to facilitate routines on the unit, understanding the benefits of it, purposeful engagement, and understanding how to facilitate engagement in purposeful activities, as well as understanding the importance of routines and rituals. The two that stayed the same were the principles of trauma-informed care and the understanding of the prevalence and impact of trauma-informed care. Similar to the mental health unit staff education, the occupational therapy education that I provided an increased understanding of my learning objectives. So through the survey, I learned that they had an increased understanding of occupational therapy's role in mental health, how to write a goal that addresses mental health, understanding mental health interventions that can be applied to all practice settings, and they had an increased confidence in identifying items in both the chart review and the evaluation or treatment sessions that would lead them to address mental health. To further discuss my results, the unit staff members reported an overall increase of the educational topics. As well as with the occupational therapy team members, they reported an increase in understanding of occupational therapy's role, increase in understanding of how to address mental health in their practice area, and an increased confidence in identifying when to address mental health. Another outcome of my project was this resource guides and the online education, which I found out will be now used to onboard a new mental health occupational therapist onto the unit, which is really exciting. There are several future work recommendations that I came to after working in mental health and working with Eskenazi. For example, I think it is important for OTs to further explore mental health documentation to ensure we are communicating the value to our shareholders, insurance, and communicating our value overall to the team. I believe it's also important to look at the frequency of one-on-one sessions, staffing ratios, and evidence-based one-on-one interventions, making sure that we are truly being evidence-based in all of our practices and ensuring that we have proper staffing ratios to serve our clients. Some future staff education that I would recommend would include sensory processing, rituals, working with people with dementia and developmental disabilities, I believe that also my educational resources and resources in general should be updated regularly to continue with evidence-based practice and relevant practice. Overall, I think that my project increased understanding of OT's role in mental health for both occupational therapists and non-occupational therapists working with mental health, as well as provided resources for an OT that will be working in mental health. If you scan this QR code, you will be able to see my references, which I used for this presentation, and my project overall. Thank you.